Immunology drives regeneration. Immunology drives inflammation. All this revolves around immunology. What we do in this summit is basically focusing on this capacity, on the capacity of some competent elements, cells, molecules, tissues, fragments that could help out us to drive these immunological competent elements into healing, into regeneration.
Hello, everyone. In today's episode, I have Dr. Ramon Llull, and he is a assistant professor, plastic surgeon at Wake Forest University, and his expertise is on immunology and plastic surgery. And I am so grateful that he's here to join us today. Hello, how are you?
Greetings, California. Greetings from Wake Forest University.
Wonderful, wonderful. And thank you for being with us today. So let's dive in. What is immunology and plastic surgery? When I heard that phrase, I'm like, I don't know what that means. And I had to clarify with you several times so I can understand that. So kind of teach us, what is that unique specialty?
Immunology drives wound healing. Immunology drives regeneration. Immunology drives inflammation. So all this revolves around immunology. And then plastic surgery moves tissues around, just like furniture. We kind of move around in our living room. But in doing so, we move also immunological components of the tissues when we move them around. And we move them around to patch a defect, fill a hole, mend an injury. And in doing so, then we affect these immunological properties. What we do in this summit is basically focusing on this capacity, on the capacity of some competent elements, cells, molecules, tissues, fragments that could help out us to drive these immunological competent elements into healing, into regeneration.
Wow, that's all jam packed in what you said. So let's kind of dive into this. So at the Regenerative Therapy Summit that is in San Diego, what will you be teaching at the summit?
We are going to be defining what is wound healing. We're going to be defining what's regeneration. Why is it that we fail to regenerate very much like the salamanders do? And on the other side, where does it reside in our body? The capacity for us to heal and to regenerate. Because, yes, we favor healing because we wanted to maintain integrity, but we still have the capacity to regenerate. So where is the repository of this regenerative capacity? So we found it, and we are trying to exploit it in not only to kind of heal a wound or cool off a joint or fight off cancer, also to rejuvenate and keep up with the tissue decay in such a way that we can maintain our bodies in a healthy state.
Wow. So why does physician need to know how? Obviously, the immunology affect wound healing, but what is so unique about the immunology system that affect the wound healing that we need to know about?
Because it is the director of all of this. Last year, Nobel laureates were awarded to those who found, a type of cells and some genes that indeed what they do is to control the immunology, the inflammation, the capacity to respond against our own tissues within the tissues itself. Now, we have brought up this attention into the adipose tissue. And in the adipose tissue, we find some cells from a tissue that is expendable, that is accessible, that is, very accessory in such a way that we can just harvest that and then use it to the best possible way to kind of heal important diseases, trauma, cancer, transplantation. So we are able to gather, to harness all these cells out of an otherwise discardable tissue and make the best out of them.
What will physician learn at the summit that they won't learn anywhere else from you? What are you sharing? You're sharing your best secret?
It is not secrets. What happens is this is a revolution. What we are trying to do is trying to, share this with other colleagues, far more smart, and intelligent, and wise, and powerful than ourselves, in such a way that we can just spread that, if you will, not a gospel, but rather a different paradigm in medicine. What we're trying to say is that, we have other ways to heal you other than a scalpel or a pill. We have the capacity to heal ourselves with our own cells. And one way to get them in such a way that we don't harm people much is by just getting these cells out of an expendable tissue such as adipose tissue. And in this way, we can just study these cells. And it look very trivial to you, very benign. Oh, after all, these guys, the only thing is they kind of do is suction fat and then do cosmetic procedures. Well, by doing this, we do it well, and beyond that, we answer fundamental questions in biology.
As I'm talking to you, I'm learning so much because that's not something that I would think about. And what made you get interested in this field?
What made me interested is this component of need. Go travel. Go travel not only in our own countries where workers get injured, or where cancer is an important issue, as well as obesity. But go travel farther out, and then you'll see burn sequela, and you will see major trauma, and you will see other injuries that are really powerful. We apply our current knowledge in plastic surgery, in reconstructive surgery, in cosmetic surgery to heal trauma, to rejuvenate people. But we need something else. We need something that is less invasive than the surgery. We need something that is more specific than a blade. We need something that is within us that can just kind of empower us to heal better. So all this summit is about changing the way we heal.
So tell us a little bit about yourself. And, if someone is at the summit, what question do you want them to ask you?
Anything and everything. I was born in a small little island in the Mediterranean from a very humble family. And for strike of luck and some little persistence, I kind of managed to get a PhD in immunology in California at UC Irvine, and also plastic surgery training at University of Pittsburgh Medical Center. So, other than that, which is basically jumping two worlds, Europe, the old world and the new world, in between my love and passion for plastic surgery, and my family who was left behind in Mallorca, then anything and everything, it's welcome.
What's remarkable is your expertise and your background. I mean, you have a PhD, in before you were a plastic surgeon, and that background is amazing. So, and what I always find amazing is the variety of experts that are at the summit and the accessibility of talking to someone like yourself and learning about immunology and wound healing, which is a totally new aspect for me, and I can't wait to dive in more detail with you. And I'll be the first one to be cornering you.
No, but you will see. There's a whole bunch of other different people who will be coming from Europe, here from United States. A number of international delegates who will kind of make sure that provide different angles, different visions, different approaches, different applications to this technology that we are trying to promote in this Regenerative Therapy Summit.
Absolutely, because oftentimes, when we're doing regenerative therapy, we focus on the procedure, and sometimes we don't focus as much so much as in wound healing. Optimizing wound healing, and that is so pivotal. So, and I know you've been involved with Regenerative Therapy Summit for several years. What makes this summit so unique from other regenerative conference?
A number of things. First, the city. San Diego is spectacular. It's fantastic. Second, the sponsor. Tulip Medical has been in the field of cosmetic and reconstructive surgery for many years. I got to know its founders when I was a resident at the University of Pittsburgh Medical Center. And since then, kind of we've developed something that it goes beyond professional, but rather a very interesting relationship that is paired up with inquiry. What's going on? Why? How can we just kind of obtain pieces, parcels, fragments, cells from adipose tissue in such a way that it's easy for the professional, easy for the patient? So that's the second thing. The third one, it's been that, Arts is got a brand already. And he has learned not only excellent professionals with great expertise from orthopedic surgery to gerontology to cosmetic medicine and surgery, but also a number of extremely avid professionals who want to incorporate that into their own practices. There are a number of basic scientists, but also there is a vast platform of professionals who really hone down all this body of knowledge into something practical. So there is a number of audience who come in here really thirsty for, okay, spill the beans and tell me what is in it. What do I need to do? What's the expected outcome? How can I improve my patients? And these are kind of the three major strong points for this regenerative therapy summit here in San Diego at the end of July this year.
I was amazed at the expert speakers that presented and the diversity of the different specialty, as well as the accessibility to talk to the speakers at multiple networking event. As well, and of course, San Diego. You have to know the beauty and the environment. And this year is going to be at Torrey Pond. So, what do you do to relax? What do you do to relax? And don't tell me that you're going to read about immunology. What do you do to have fun and relax?
First of all, I got 3 grandchildren. So this is a total fun for me. The second thing is that I paint. I take pictures. I do some photography. And I also sculpt. So that's what I do for fun.
Wonderful. Grandkids and paint and photography, right?
Yep.
Yeah, wonderful. Well, I'm looking forward to seeing you in person again at the summit. And that's going to be held on July 30th to August 2nd. And there's going to be a lab as well that is going to be on the 2nd. Will you be in the lab as well too?
Count on it.
Okay, wonderful. I'm looking forward to that special day. So, doctors, if you're looking for a conference that you can go to that you want to learn, especially about immunology and wound healing from the best there, consider going to the Regenerative Therapy Summit and come say hello to Raymond.
Please do.
As well too. We look forward to seeing you all there.